All right, so this is gonna be my normal and abnormal delivery. So first I'll make sure PPE seems safe. And so mom, pregnant. I'm gonna ask a couple of questions, make sure when her due date is, how frequent her contractions are, duration, intensity, make sure embryonic fluid is not leaking out. In this case, she is. There is a little bit of vaginal bleeding. She does have abdominal pain, and she has no past history, and this is her first baby. All right, so I'm gonna get some vitals. All her vitals look good. They look solid. She is not on any medication. And she is starting to crown and having the urge to defecate. So first I'm gonna prepare my delivery area, make sure I got some towels under her bum. Make sure there's no clothes in the way, make sure it's all clear and clean. And I'm gonna open my OB kit and make sure everything is set up, everything I need. Make sure my bulb syringe is nearby, my cord clamps, and some extra towels. All right, so now that I'm all ready, when she feels the need to push, I'm gonna let her start pushing, start encouraging her to push, and so once she starts to push and the baby starts to emerge, I'm going to notice that the cord is wrapped around. I can get him out. Around the neck, and it is head first, so it's not a breech. So when the cord is around the neck, I am going to do a V shape, make sure the baby's able to breathe, and with the other hand, make sure get the cord out of the way to be able to clear the cord. And once the cord is clear, it's no longer an abnormal delivery. Everything else looks pretty good. I'm gonna keep encouraging her to push. And once the baby comes out, make sure I know any meconium staining. Right now that the cord is out the way, it is not a rapid transport. We can stay and deliver the baby safely. So once the baby's fully out, I'm gonna place the baby on the mother's chest, and I am going to name or note the time of birth, and control any bleeding, hemorrhaging, and I'm gonna check on the mom's vitals, just make sure we're all good. So then I'm going to now move to the back to the baby, make sure it's clean, warm, and dry. I'm gonna clear its airway and make sure it is breathing adequately. And I'm going to wrap the baby up in a nice warm blanket and use a heating pad to make sure it stays warm, especially on cold days or cold environments. So now I am gonna make sure the baby is not gasping or apneic and heart rate's at least 100. So if the baby is under 100, I'm going to give positive pressure ventilation with no oxygen at first, but the baby's breathing good. The SpO2 looks good on the baby. So I'm gonna go ahead and clamp the cord 2 to 6 and go ahead and put the baby back onto mom's chest. And while I do that, I'm now going to check the APGAR score for the first time. Make sure the APGAR score is good. It's solid. It's a 10. The baby's breathing adequately. Heart rate's 140. We don't need to do chest compressions or none of that. And make sure mom's okay and start transport to the nearest hospital. Preferably one that can handle a good hospital, preferably probably Tyler. And I'm going to check app score again in 5 minutes.